breaking news from CBS 2.
Good afternoon, everyone. Jim Williams here. Governor J.B. Pritzker is about to give his daily briefing on the coronavirus in Illinois. Let's listen in.
Well, good afternoon, everyone, and happy Sunday to all. We'll be keeping it brief for you this afternoon. I'm pleased today to welcome home from overseas the 1st Battalion of the 178th Infantry Regiment of the Illinois National Guard. Under the command of Lieutenant Colonel Matthew Garrison, 400 of our most exemplary Illinoisans served in Afghanistan to advance Operation Freedom's Sentinel. These are remarkable individuals who possess a phenomenal strength. And as soldiers of the 178th Infantry, also carry the legacy of having descended from the nation's first all-black National Guard unit, the Fighting Eighth. As governor, I have the honor of serving as the commander-in-chief of Illinois' citizen soldiers. And in my first 16 months, I've learned a thing or two about the 13,000 women and men who make up the Illinois National Guard. Namely, they're an astonishingly humble group, even though they've earned the right to take extraordinary pride in what they do. In the midst of this COVID-19 emergency, I hope you've had a chance to see, as I have, just how amazing the Illinois National Guard is, because it's the Guard that's setting up our drive-through testing sites to serve our first responders, our medical professionals, and everyday residents. It's the Guard that has helped to build the alternate care facility at McCormick Place at a jaw-dropping record pace. It's the Guard that has provided critical surge support as we've managed outbreaks in our facilities. It's the Guard who deserves our deepest reverence and gratitude. I also want to share more positive news on the PPE front. We have another airlift of PPE arriving tomorrow in Illinois. That follows our first flight that landed earlier this week. I'll note that it's the Illinois National Guard handling transportation logistics on the ground and ensuring that our protective equipment gets to the front lines in the COVID-19 battle. These millions of masks and gloves and other PPE will be taken to our state warehouse where inventory and performance quality checks are done before we ship them out to keep our first responders and our healthcare professionals protected as they work to keep us safe. If it strikes you as atypical that in the midst of a national emergency, a state is directly airlifting emergency response materials from another country, well, you'd be right. But that's the landscape that we're operating in, competing with other states, other countries, and even our own federal government for supplies. So if an airlift is what it takes to bring the PPE to protect our nurses, our firefighters, our police officers, and other essential workers, then it's an airlift that we'll use without hesitation. Thank you all for tuning in over the weekend. We'll be back tomorrow with our regular update. Before we move to press questions, I'd like to turn it over to our Director of our Department of Public Health, Dr. Ngozi Ezike, for today's medical update. Doctor.
Thank you, sir. Good afternoon, and thank you for everyone who tunes in every day as we report out the latest developments and the governor shares his plans to help us through this difficult time. Your ability to stay informed and to use that information to make good personal choices is what drives our efforts each day. Our goal is to give you the most up-to-date information that will help you understand, of course, that COVID-19 is very serious, but especially to make you understand the essential role that each of you play in helping Illinois get back on track. Today, I announced that there are 1,197 new cases of COVID-19 and unfortunately 33 new deaths. That brings our state total to 30,357 and unfortunately 1,290 total deaths. I know the COVID-19 pandemic can be overwhelming for parents and is concerning as well to children. As a mother and as a pediatrician, we recommend that parents, guardians, and others who work with young people strive to help them feel understood, empowered, and yes, hopeful. Assure children that doctors and other healthcare workers are learning as much as they can about this virus as quickly as possible and are doing everything that they can to keep them safe. Empower them to keep themselves safe by following guidelines on physical or social distancing, cleaning surfaces, washing their hands, and wearing masks. Encourage them to feel comfortable in sharing their emotions during this tough time. We all need extra support in this unprecedented moment in history. I receive support from my public health team, my local community, my faith community, and my family each day. We all have to support each other in these trying times. COVID-19 has dramatically altered all of our lives. It's changed our way of learning, working, recreating, praying, sharing, everything. It's also stolen precious loved ones from us and even changed how we mourn for them. Though we can never go back to how we were and will never get our loved ones back, we still must stand together and employ the ongoing required sacrifices to end this pandemic. Let's continue to be all in Illinois. And now the comments in Spanish. Buenos tardes. Gracias a todos los que se unen cada día con nosotros para saber la información sobre la respuesta de COVID-19. Su capacidad para mantenerse informado y utilizar eso para tomar buenas decisiones personales es lo que guía nuestros esfuerzos cada día. Nuestro objetivo es traerle la información más actualizada que ayudará a dar cuenta que COVID-19 es una cosa seria y que usted juega una parte esencial para ayudar a Illinois a recuperar. Hoy IDPH informa 1,197 casos nuevos y 33 nuevas vidas perdidas a COVID-19. Esto nos trae 30,357 casos total y 1,290 muertes totales. Sé que la pandemia de COVID-19 puede ser difícil para los padres y preocupante para los niños. Recomendamos que los padres y personas que trabajan con jóvenes se enfocan en ayudarlos a sentirse comprendidos y empoderados. Asegurar a los niños que los médicos y otros trabajadores de salud están aprendiendo todo lo posible sobre este nuevo virus lo más pronto posible y están haciendo todo lo posible para mantener a todos seguros. Apoye a los jóvenes para que sigan la información sobre distanciamiento social, limpieza de los edificios, lavando de manos y uso de máscaras. Anímelos a sentir cómodos al compartir sus emociones durante este momento muy difícil. Todos necesitamos un poco de apoyo adicional en este momento sin precedente en la historia. Yo recibo apoyo del equipo de IDPH, mi comunidad local, mi comunidad de fe y mi familia todos los días. Todos tenemos que apoyarnos mismos en estos tiempos difíciles. COVID-19 ha alterado dramáticamente todas nuestras vidas, ha cambiado nuestra forma de aprender, de trabajar, de rezar, jugar y compartir unos con otros. COVID-19 nos ha robado vidas preciosas y ha cambiado la forma en que honramos los que pasaron. Aunque nunca podemos volver a vivir como antes y nunca volvemos a ver a nuestra familia que han muerto, debemos unirnos y emplear los sacrificios necesarios para poner fin a esta pandemia. Gracias. And with that, I will turn it over to Governor Pritzker.
Thank you, Dr. Ezike.
And reporters, just before the governor takes questions, check your inboxes today because we're going to go to a pool system. I know some of you are more familiar with pools than others, so we're going to move to that system starting Monday.
Happy to take any questions from members of the news media.
Okay. Hi, I'm Michelle Fiore from Fox 32.
Hi, Michelle.
My first question, how are you? My first question is that we've seen people loudly protesting in states like Michigan and Wisconsin. Today, we actually saw a few cars driving around the block here also protesting the stay-at-home order specifically. What do you say to people who just want to get back to work, and especially to those who may be planning protests that may not be abiding by the social distancing rules as we saw in Wisconsin yesterday?
I think I would say to all of those folks who legitimately want to get back to work that I do too. I want people to get back to work. I want people to go back to school. And I want us to have a great summer. And so I'm looking for all the best ways to make that happen. But we're in the middle of an emergency, a pandemic. And it's like nothing that we've ever seen, at least in our lifetimes. And so we're listening to the experts and the scientists, and you've seen some of them here at this podium before. And I've talked about them, the University of Chicago, the University of Illinois, Urbana-Champaign, UIC, and Northwestern and others, SIU, the experts that we're relying upon, and then the national and international experts, former heads of the FDA and other CDC and so on. I've had personal conversations with Dr. Fauci. And the fact is that we have got to be very careful as we make decisions about change in the stay-at-home order to keep people safe. And I'm looking at all of the ways in which we can open things up and keep people safe. And so I want us to get where they want us to get to.
All right, next question. You ordered schools to remain closed through the end of the semester. President Trump is talking, of course, about opening the country, possibly in stages. And there are parents out there today who have giant concerns wondering if their company says they're one of the people who has to stop working from home and have to start going back into their businesses while their kids are still home. Can you answer what Illinois might be able to provide to those parents?
In terms of child care, for example, we've created emergency child care. In fact, all across the state. That's something we did weeks and weeks ago because of the essential workers and their needs. And there is capacity out there, and we, of course, want to encourage people to become emergency child care providers. So to the extent people will go back to work and their kids will be at home during the school year, that is one option for people. Of course, during the summer, people, who normally work and their kids would be not in school during the summer, they'll have that same problem if the kids were otherwise going to go to some congregate setting, a day camp or something else. And so we want to continue to provide that kind of child care capability all across the state.
Okay, my next question. There are people who are still going into their places of employment, obviously, such as nursing homes and things. In many of these businesses, they are doing their due diligence, they're checking temperatures right at the door. But is that enough, given the fact that COVID-19 can be asymptomatic for so long?
Yeah, the answer is no, it's not enough. And what we really need is rapid testing in all of those settings, the ones that you're describing, congregate settings, but also everywhere else. What we really would like is for people to be able to get tested on a very regular basis until we have a treatment and a vaccine. You want to know that people who are coming to work with you are not COVID positive. The challenge, I think, as you are well aware, is that for the weeks and weeks, now a couple of months that have gone by, the understanding by the scientists and the doctors has evolved because they've come to see, for example, what you're describing. People can be asymptomatic and pass along COVID-19. That wasn't something that the CDC, for example, or the federal government or anybody really was saying a month and a half ago. And so as we learn more, the evolution of how we think about how to get back to work changes. But you're raising an excellent point. We need more than just a temperature check at the door. Right now, that's the only thing that we really have, doing a wellness check for workers that walk in and doing a temperature check, which is, takes a moment to do.
I have a question from a colleague. Michelle Gallardo from ABC7 wants to know, earlier this week, the state reported the death of a teenager in Cook County. Are you familiar with this case? If so, is this the state's first teenage death? And can you tell us if the teenager in question had underlying conditions?
I don't have that information at my disposal at this time. I know we have had people of all age groups die. I just want to be clear in terms of the definition of people dying of COVID. So the case definition is very simplistic. It means at the time of death, it was a COVID positive diagnosis. So that means that if you were in hospice and had already been given a few weeks to live, and then you also were found to have COVID, that would be counted as a COVID death. It means that even if you died of a clear alternate cause, but you had COVID at the same time, it's still listed as a COVID death. So everyone who's listed as a COVID death doesn't mean that that was the cause of the death, but they had COVID at the time of death. I hope that's helpful.
Can I ask a follow-up question? How unusual is it you're looking at the numbers, to have a teenager die from this?
Well, I will say that we know for the pediatric literature that pediatric deaths from COVID are low. I know that as we get older, so obviously a 2-year-old and a 17-year-old are all considered pediatric patients, but we know that the 17-year-old has the physiology much closer to an adult than, say, an infant or a baby. And so as I know that, at former hospitals that I've worked with and pediatricians that I've talked to, they have seen severe illness in older pediatric patients as they look more like adults than babies.
Hi, Governor. Will Jones from ABC 7. I have 2 questions. The first one is for you, and then the second one is for Dr. Ezike. The first question is, what can you tell people who are anxious about when this is going to be over?
Well, the first thing I would say is that frankly, I think everybody is anxious because we don't know so much, right? There's a lot that still needs to be learned here, and we don't have the treatment or the vaccine to really deal with this in a way that will make people feel safer. But as we're learning more and sharing information all across the country, and as the CDC provides more information, as our Department of Public Health does its work, I think we're getting a greater understanding day by day, and people should feel, I think, somewhat more confident today than they did weeks ago, and let me give you one example of why. I think I may have mentioned this in the last couple of days, but the report out of a Chicago hospital, it was the University of Chicago, that the trials on remdesivir, one of the 70 different treatments that are in trials right now, that the reports are very positive. Now, that doesn't mean that the study is completed and that this is an approved treatment. But the idea that there's something that's gotten positive results and that at least is rumored to be one of the main treatments that may be available, I think that is some really great news, right? That's something to add on to as we see the bending of the curve here in the state. If you can have a treatment, right, and then you see the beginning of a decline of cases and a decline of hospitalizations, having a treatment makes an enormous difference. So people should start to feel more confident seeing that our amazing private sector researchers, and that's really what's happening, many of the private companies, the pharmaceutical companies, as well as our NIH scientists, that collectively the United States is the greatest country in the world, and indeed because we are so innovative. And in the face of this pandemic, the idea that we're, 70 treatments are in trials and a few of them look like they might be effective in just a couple of months, that's pretty amazing.
And this is for Dr. Ezike. We've been in this stay-at-home order for several weeks now. Some people are wondering, how is this virus still spreading?
Well, I think we have to say that we know that there are people, it's not like we're on complete where everyone is in their homes. People have to move around. I think what we do know is that the reason that the virus has slowed down its transmission in our state is because of the stay-at-home order. We don't have a situation where it can be 100% because not every single person is at home. Let's look around this room. So there is still transmission that can go on. It's absolutely lower than what it was previous. I don't know if we want to get into the statistical terms, but when we think about epidemiology and transmission of disease, the R0 value, which maybe some people have heard of, basically is an indicator of like how many people a person who has the disease will infect. And so we think at the beginning, when we were in that exponential growth phase, the number might have been 3.5. And so just if you think for a moment, if one person can infect 3, and then each of those people infect 3 additional, and then those people all go on to, I mean, within 10 rounds, you get to 60,000 people, right? And so obviously we've brought that way down. We think our R0 is low in the 1s, and so the transmission has slowed tremendously. But of course, it's not enough to have completely made sure that it died out.
And ultimately, what you want is an R0 value that's below 1, and that begins to, have real decrease of infection rates.
Hi, Amy Jacobson, WIND Chicago. I have a question for you and a question for the doctor as well. I won't hog the mic. First of all, I wanted to wrap up. We're not in phase 1 because phase 1, like
Right.
Dr. Fauci had, is
After I left
movie theaters,
yesterday, I realized
and restaurants and gyms. So
You're right,
hopefully
Amy,
we
you're
can
right.
get there.
Yeah,
Hopefully we can get
agree.
there. The PPE that's landing tomorrow, where is it coming from? And what do you want to say to the FBI agent here in Chicago who stopped your procurement team from wasting $26 million of our tax dollars? Because there's a lot of scams going on, not just in Illinois, all over the country, and they were about to purchase $26 million or pay a company that money, and it was a fake company.
What was the first question? Sorry, about
the
when
PPE, where is it coming from?
Oh, it's coming from China.
It's from Shanghai?
Yeah, I think as you well know, but you should know that, at least I don't think that this one is coming from Shanghai. You should know that most of the PPE that is manufactured in the world, and again, we're talking about disposable PPE, not the fabric masks and other things which are much more expensive, but the disposable PPE, which is needed by healthcare workers and first responders, that comes from China, and so this is coming from China also. I don't recall right now where this particular shipment is coming from exactly in China. As to scams, oh my goodness! I mean, I've talked to other governors. Yeah, as you can imagine, I mean, you've seen it all online. If anybody's even looked for any PPE on their own, and the scams are everywhere, and you can imagine, big ones and small ones, right? And people have tried to contact us to get us signed up for delivery of PPE that doesn't exist, and we've had to ferret those things out, and we've definitely been working with law enforcement, also with the Attorney General. I think I mentioned that yesterday, that we need our Attorney General on it, but if you're talking about an international seller, but we're not allowed in the state of Illinois to purchase directly from any international provider, and so we use either an Illinois company or a U.S. company to go find that for us, and so sometimes in that process, there can be bad actors, and we definitely rely upon the FBI and our state police and our Attorney General to help ferret those things out for us.
Thank you very much.
Thank you.
Doctor, I have one quick question. First of all, thank you for all that you've done and your dedication to this. I think it would be helpful for all of us Illinoisans if we knew, because every day you come out with numbers, how many of those are active cases, how many are in ICU, how many have recovered, because I think that would help maybe some people sleep better at night, because I know we're going to have larger numbers because more people are being tested.
Right. So how do I break this down? So in terms of, we've tried to give some recovery data. I think on Tuesdays I've been trying to give recovery data and have tasked my team with surveying people who have been positive with the electronic survey. And so I know last week with the electronic survey, they followed up with calls for people who didn't respond. And it ended up that people after 28 days, 69%, I was rounding it to 70, but it was 69% of people said that they were recovered. It was obviously a little bit lower for 21 days and 14 days, and just 7 days after it was like in the 40s, but it got up to 69% after 28 days. Overall, again, The denominator of the number of people who have contracted the disease is not clear because we've tested who we've tested, but we know that there are many other people who have had the disease but don't have the laboratory confirmed diagnosis. But of the people that we did have a laboratory confirmed test, our hospitalization data is something in the 25 to 32% range, and I think we know that the ICU rate is 5%. So we know that most people do very, 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 very well. We know that people recover after several weeks. I don't want to just be the agent of doom and gloom. People do recover from this disease, but we still have to have a special eye for the people who will have a harder course, and those are the people over 65. Those are the people who have comorbid conditions, and just to repeat them again: hypertension, coronary artery disease, other heart disease, COPD, diabetes, obesity, people who are recovering from cancer, who are otherwise immunocompromised. Let's not forget that pregnant women are people who were recently pregnant, as well as liver patients, hemodialysis patients. I hope I didn't forget anyone on the list, but any of those people are higher risk, and so those are the people that we're trying to be really focused on, as there is no treatment and there is no vaccine, so that we can prevent these additional severe morbidity and mortality.
Hi, Governor. Mike Puccinelli from CBS 2. So Vice President Pence says 5 million tests should be completed by the end of the month. He calls that a success. Nancy Pelosi was on Fox News this morning. She gives President Trump an F when it comes to testing. So who's right, and where do we stand in Illinois right now?
Well, let me respond to the question about testing. I've been frustrated when I hear the White House talk about testing capacity versus testing. They seem to use those interchangeably. Those are very different. Testing capacity is the capability machines that exist in your state that could possibly run a test. But as you know well, because I've talked about it a lot over the last couple or month and a half, that you need a lot of other things in order to actually have a test result. You need a swab to take the specimen. You need the viral transport medium to put the specimen in so that it can be transported safely. You need the RNA extractor so that the process can run properly, and you need the machine. And oh, by the way, you need lab technicians, and a lot of them, because we're doing a lot more testing than normally gets done because we have this novel coronavirus that we have to test for. So when you think about testing capacity, they say, well, we have the ability to do X number of tests. Well, yeah, testing capacity is large, but if you don't have all of those items, which, by the way, none of the states have all of those items that they need, you can't actually use the testing capacity that's available. So very frustrating. Look, today, where are we? Well, you saw today we announced 6,000 specimens were announced today that were tested, and you saw that 1,100 and some positives among the 6,000. We have a fluctuating number every day. It's going to be different each day because you get different reports each day. I'll tell you, today we got no report from one of the largest commercial laboratories in the country. And so that's a number of tests that were obviously done and completed but never reported to us because they didn't report it to anyone in the country. Why that is, I can't tell you, but we'll get those tests tomorrow, and hopefully we'll get all of the tests that were done yesterday reported tomorrow, and tests today reported tomorrow. But we're a little bit at the whim of these commercial laboratories. Now, we control our own state laboratories, which are doing amazing jobs, and then we have terrific hospitals here in the state that are doing a lot of testing as well.
I spoke with Dr. Howard Ehrman from UIC right before I came here, and he said the problem with a lot of what you've done is that you've made the procedures and the policies optional. He said, for example, masks, why not order the use of masks so you'll
Yeah, I
save
haven't
lives.
been. I appreciate that, and he's right. I didn't order it, and I have considered doing that, and still am considering doing that. As you know, I came out strongly and told people that they should be wearing masks, and every time I talk about this, wash your hands, wipe your surfaces, make sure you're wearing a mask when you go outside. But have I put an order in yet? No. But you're foreshadowing that. I spoke with. I mentioned this also a few days ago that one of the Republican state representatives, Mark Batnick, has been very helpful providing ideas, and that is one idea that he suggested. Now, he wants it his suggestion was just for retail establishments like grocery stores and the essential workers all wearing them, and people who go to those locations as well. That's a good first step, for example, but I don't disagree with the comments of the doctor. It may be that the right answer is everybody wears a mask no matter where they are outside, or perhaps everybody wears a mask if they know that they're going to be in an area with other people.
All right, we've got time for one more from the room, and then we got to get online.
Okay, go ahead.
You have one more?
Oh, okay.
Yeah, go ahead, Mike.
So if you do decide to do that order, when might that happen?
Well, that we obviously April 30 is when our stay-at-home order expires, and so we're looking at how we might make adjustments. And so obviously between now and then we'll be making some decisions about that and putting that forward. But I do want to double down on the suggestion of the doctor, on your suggestion by the virtue of the question, and my own feeling, which is everybody should be wearing a mask, in my opinion, when they're outdoors, when they know they're going to see people, particularly, as it warms up here, we want people to be safe, and they're keeping everybody else safe, to be clear, when they're wearing a mask. When you wear a mask, you're keeping other people safe, and they're keeping you safe when they're wearing a mask.
Okay, this is from Amanda Vinicki at WTTW. The Lupus Society of Illinois has a petition asking you to prohibit doctors from preemptively prescribing hydroxychloroquine as COVID prevention, as it's causing a shortage of the drugs. Will you do that? Why or why not?
Yeah. There's been a lot of discussion about hydrochloroquine by the president. He's pushed it a lot, and it therefore is being overused without a lot of testing to back it up. The decision by doctors about whether to use something that's off-brand, something that's allowed and permitted, it's an FDA-approved drug, and then using it off-brand, those are decisions that are typically made by doctors, and it's the only way you can get hydrochloroquine unless you're getting it illegally from some source somewhere. And so, I don't disagree that it shouldn't be used off-brand unless you really know that it works. And right now, we just don't know that it works.
This is from Rich Miller at Capital Facts. This is mainly a federal issue, but with so many meat processing plants shutting down or experiencing spikes in cases, is there a state role in improving these conditions?
There is indeed. The federal government, of course, regulates those plants, but it is also the responsibility of the state to keep the people who work there, who live in our state, of course, safe, and of course the businesses in our state as well. So we have worked with local health departments, in fact, on making sure that they are using PPE in those facilities and making sure that the people who work in those facilities are safe and not forced to work if they are not feeling well, if they have any symptoms at all. And some plants are very good about following all of those, and some we've had to talk to, have discussions with, and have and threaten to force closure.
Linda Lutton at WBEZ is asking you to comment on the data your office just released regarding long-term care facilities. Mm-hmm. Could you reiterate what specifically the state is doing to control the outbreaks in nursing facilities?
Yeah, I'd like to ask Dr. Ezike to talk more about that.
So we knew even before we got into having the large numbers of long-term care facilities with cases, that would be one of our hardest areas. We know that congregate settings, by definition, it's hard to be able to do the physical or social distancing and be able to separate and isolate people. So, our prisons and our long-term care facilities and any kind of group home setting. But even before there were recommendations from CDC, we had a weekend as we saw what was happening in Washington. I was immediately on the phone with the state health officer from Washington and with their clinical team to try to see what lessons we could learn from the practices and from the situations that evolved there. And so we had a weekend where we assembled the team and came up with our new heightened restrictions and guidance. And so that is when we implemented, I think, end of February, maybe beginning of March, where we said that there would be no visitation, that there would be pre-shift assessments, that there would be increased monitoring of patients, that, all the extra cleaning, making sure people had PPE. So that started early, but even with those practices, we've obviously seen cases. So now, as in an heightened attempt to take more aggressive measures, we probably started this weekend, but definitely the deliveries will continue this is a new week, will continue this week, where we are sending testing supplies to different facilities. We're trying to identify neighborhoods or areas where there's a lot of COVID-19 in the area. And so as it's a hot zone, if you will, we're worried about the facility in the midst of that. And so we're sending materials for testing to those locations so that we can do aggressive testing of the staff and people who would be in that facility, so that we can see if we can identify cases who would potentially be in that facility with that high-risk population. We're also making requests for additional support so that we can have more people in the facilities. We know that staffing can be an issue in many of these facilities, and so having enough people to ensure that all the residents are attended to and are assessed with the regularity, to make sure that there's someone at the door who can do the pre-shift assessment. We also are taking advantage of our consultants. We have a team of infectious disease consultants with UIC, as well as IDPH's infection control preventionists, who are working directly with facilities. We're trying to, there's a lot of, we have 1,100 facilities in the country, but trying to target the ones that are most at risk, in addition to the ones who already have established cases. We're really trying to be proactive, giving everyone the support they need, working with the local health departments to make sure that the facilities are provided the PPE, because if they don't have the appropriate PPE, it's really hard to contain the spread. So a lot of effort is going in. We're working with labor unions. We're working with the nursing home industry. They've gotten additional funds from HFS in order to, in certain cases, set up COVID wings or COVID institutions. So again, there's a multi-pronged effort. I know the feds had already given out a lot of money, millions of dollars, to nursing facilities to increase and staff up. And so all of these measures are hopefully trying to contain what is already a very difficult and challenging situation.
Dave Dahl at WTAX. Governor, you have gotten attention nationally during this pandemic. How does the state benefit, and how do you benefit from this heightened profile?
The most important thing that's happened is we've actually gotten more from the federal government as a result of my, having a slightly higher profile or speaking out nationally. I'm very pleased with what we've, received from the Army Corps of Engineers, FEMA, HHS, and I continue to have dialogue behind the scenes. It's not just speaking out publicly, behind the scenes, speaking with the Vice President directly, but also White House advisors, speaking to representatives of the various departments, including the Secretary of Defense, the Secretary of the Army, the Secretary of HHS, directly about our needs so that we can get them fulfilled, whatever it is the federal government can do for us. But you've heard me publicly talk about some of the things that the White House has promised and hasn't been able to deliver. And I'll continue to do whatever I have to do to make sure that we get what we need in the state of Illinois.
Mike from Quincy, how can mass testing be a pillar of our recovery recovery plan when the Centers for Infectious Disease Research and Policy says there won't be enough reagent needed to conduct those tests?
Well, this is, I think, a great example of the challenge of not having invoked the Defense Production Act. If we had done that, if we had gotten, the chemical companies and the companies who produce reagent to essentially focus all of their resources on delivering for the states, we could have been further along. But I think all the companies that produce reagent, not to mention all the other items that I mentioned that are part of the supply chain, all of those items are in short supply, and all of those items I'm fighting hard for. I will say I'm very pleased that we've been able to do more than some other states recently in order to have all those supplies to ramp up our testing, and then we need to actually ramp it up with using all of those pieces of the supply chain together.
Shia Politico, what would you recommend to Senators Durbin and Duckworth and Representative Davis, who are on the President's task force to open the economy, what to address first?
Well, I mean, I'm partial to the industries that are, particularly important here in the state of Illinois. I think one thing I think has been very challenging for people is how are we protecting, and this is very important, how are we protecting the workers and the customers in each of the retail and wholesale and warehouse situations? We're the supply chain hub of the nation here in Illinois. We have a lot of warehouses and distribution, not to mention manufacturing and other things, but how do we protect the workers and the customers and give guidance more than just 6 feet apart and a mask? By industry. I'm working on this myself, but this is a problem that every state that is similar to ours, or every industry like the industries that we have here in Illinois, is trying to grapple with. So I hope that they will address that.
This will be our last question. Jim from Rock River Times asks, now that we're seeing more grocery store workers infected with COVID-19, should shoppers worry that they will be infected by touching items they purchase, and should shoppers wipe down items that they buy at stores?
They absolutely should wipe down items that they buy at the stores. I would suggest to everybody there are a couple of very good and well thought out demonstration videos and articles about what you should do when you go to the grocery store, when you buy things, you bring them home, how you should handle that when you get home. Everything really needs to be wiped down, and whatever it is you were carrying the groceries in needs to immediately be thrown away, or if it can be wiped down, great. But you need to get it out of your kitchen and make sure that it's out of the reach of anybody who would touch it and therefore possibly be infected by something that's remaining on those items. But it can be done, and and again, there are lots of good instructional videos and articles about that.
All right, thanks everyone.
Yep, thank you.
Governor Pritzker's coronavirus update this afternoon: 1,197 new cases of COVID-19 in Illinois, 33 additional deaths, much lower number of deaths today compared to yesterday and Thursday. 125 deaths announced yesterday, 125 Thursday. Again, 33 deaths announced today. Altogether, 30,357 COVID-19 cases in Illinois, 1,290 deaths. The governor also announced a new shipment of PPE, personal protective equipment, is arriving in Illinois by air tomorrow. We'll have the very latest on our news at 5:30 or anytime at cbschicago.com. Be safe.
This has been breaking news from CBS 2.